So once the cells are ready for implantation, they are shipped back to the veterinarian in special containers that keep the cells at the right temperature. The horse then comes in on an outpatient basis and is rescanned to ensure that we know the correct site, or the ideal site, the optimal site to introduce the needle into the damaged tendon or ligament. The horse is sedated for this procedure, again with alpha-2 agonist and butorphanol, and once the site has been identified, the limb is blocked with regional analgesia, usually for a superficial flexor tendon injury, by blocking both the palmar nerves deep to the fascia in the proximal metacarpal region, and also local put subcutaneously either side of the limb in order to block the skin sensation. Thereafter, the area is scrubbed well to ensure that it's a sterile site, and then the stem cells are aspirated into a 2 ml syringe. Usually there is 5 million cells in 1 ml of supernatant. Having got the syringes preloaded with the 2 separate aliquots of stem cells, the ultrasound probe is then enclosed in a sterile sheath. An arthroscopic camera drape can be used for this if the end is sealed, and then the needle is introduced in a sterile fashion into the lesion using ultrasound guidance. Once the needle is correctly identified within the lesion and only within the lesion, so it is not present outside the damaged tendon or ligament, the syringe is attached to that needle and the stem cells injected. It's usually possible to follow the spread of these stem cells because of the small amount of air bubbles that are present inside the solution, which show up very well on the ultrasound. And in a fresh lesion you can see excellent spread throughout the lesion. Thereafter the limb is bandaged with a Robert Jones style bandage to minimize any leakage post-injection. The horse usually receives a injection dose of antibiotics as a precaution against iatrogenically introduced infection, although this has never been observed. Thereafter, the horse enters a controlled exercise regime with a steady increasing amount of exercise with careful ultrasonographic monitoring to check that the lesion not only fills in but that the quality of the repair tissue is good.